So the first is entitled Upbuilding. We have a 37-year-old male, newly diagnosed, recently discharged from 1 month stay in hospital for cryptococcal meningitis. He is cachectic. He previously weighed 70 kilograms at a height of 5 feet and 8 inches. He now weighs 45 kilograms. The discharge instructions mentioned upbuilding diet, but no further details were given. He was referred to you by the admitting physician for continuity of care. Next, it's entitled Upbulking. We have a 27-year-old male, a frequent gym goer. However, he had to stop when he was diagnosed. Now, he wants to go back to the gym and asks you about mass gainers, supplements, whey protein, creatine, amino acid, etc. He is 5'6" in height. His weight is 55 kilograms. He asks you how he could supplement his bulking regimen with diet and supplements. And with his ongoing ARVs, meron ba talagang bawal?
So our topic for today, so we'll focus on nutrition in the context of HIV. So yung magiging outline ng talk natin would be, of course, we'll discuss yung basic principles of nutrition in relation to HIV. Then we'll also discuss on how to compute the BMI, since a lot of people are asking yung proper way of computing the BMI. Then we'll also talk about yung recommendations on regarding macronutrients and micronutrients. And of course, we'll also discuss yung common complications in HIV and how can we address it through diet and nutrition. And lastly, yung mga diet tips for HIV. Okay. So can my HIV status or any HIV treatment affect my diet and nutrition? So the answer is yes. People with HIV sometimes face issues that can affect their nutrition. So very important ang nutrition when it comes to treatment ng HIV. So we all know na people living with HIV, there are changes in their body's metabolism. A lot of medicines, especially materials natin, can upset the stomach, can cause nausea and vomiting. Of course, opportunistic infections that can cause eating or swallowing issues like candidiasis and Kaposi sarcoma na na-mention ni Doc kanina sa talk niya regarding dermatology. And of course, foods that can affect ARTs, especially mga raw food like raw meats and raw fish. So it's really important na ma-discuss natin yung importance ng nutrition when it comes to dealing with people with HIV. So the cornerstone is that no matter your HIV status, healthy eating is good for your overall health. So just like any other diseases and just like yung recommendation natin for normal individuals, for healthy individuals, healthy eating is good for our overall health. So what are the benefits of healthy diet for people living with HIV? So first, it provides the energy and nutrients your body needs to fight HIV and other infections. Next, to maintain a healthy weight. So na-discuss kanina, there's a theoretical case natin na a lot of people suffer from weight loss. So it's really important na ma-maintain natin yung healthy weight natin through diet and nutrition. Next is to manage HIV symptoms and complications. And lastly, it improves absorption of medicines and it helps manage the side effects of these medications. So we talked about yung diet and nutrition, and part of lifestyle changes would be exercise. So exercise offers benefits that can help you maintain good physical and mental health. It can also increase your strength, endurance, and fitness, and help your immune system work better to fight infections. So a lot of people say na they are worried na baka hindi na sila pwedeng mag-exercise or mag-workout or mag-weightlifting when kapag na-diagnose sila ng HIV. So people living with HIV can also do exercises na ginagawa din ng normal and healthy living individuals. So wala namang pinagbabawal or like restrictions when it comes to exercise. So these are the basic principles of nutrition and HIV. So first, eating a diet high in vegetables, fruits, whole grains, and legumes, since these food items are high in fiber and could also increase can aid in our digestion. Next is choosing lean and low-fat sources of protein. So yung bioavailability ng sources of protein natin is really important. Next, limiting sweets, soft drinks, and foods with added sugar. And lastly, including proteins and little good fat in all meals and snacks. So next, we'll discuss on how to compute yung BMI natin. So ano nga ba yung BMI? So BMI is just a comparison of your weight compared to your height. So it is calculated by dividing your weight in kilograms by your height in meters squared. So it gives you an idea if underweight ka, kung normal weight, overweight, or obese in relation to your height. So just a disclaimer, BMI is not really the most accurate and the best way to measure your nutritional status, since we all know naman na kapag nag-gain tayo ng weight, pwede din naman nag-gain tayo ng muscle mass. Not really nag-gain tayo ng fat. So it's really important na better pa din ang body fat percentage as a reference kung i-computin natin yung nutritional status natin. So this is the basic computation for BMI. So weight in kilograms divided by height in meters squared. So there are two classifications that are used when it comes to identifying the nutritional status for BMI. So here we use the WHO and the Asia Pacific classification. So it's better to use the Asia Pacific kasi mas ginawa siya for Asians, since mas maliit yung body frame natin, yung body size natin. So mas mababa yung reference values niya compared sa mga Caucasians na ginagamit ng WHO. Alright. So next is how to count calories. So you can use the QR code flashed on the screen to download this application. So this is not a paid advertisement or sponsored ad, but if you want to track yung calories natin na hindi tayo nahihirapan, we can use this application called MyFitnessPal. So you can just type kung ano man yung food item. So for example, if kumain ka ng, for example, chicken adobo, you can type chicken adobo, then ilagay mo lang yung number of servings and yung serving size, then lalabas na yung mga nutritional facts such as yung calories niya, total fat, cholesterol, etc. And if you are eating an item na may barcode, you can just scan the barcode and lalabas na agad yung nutritional facts na. So it's really helpful if you just want to track yung calories mo, especially if hindi ka naman masyadong knowledgeable sa mga macronutrients and micronutrients na laman ng mga food items natin. So next, so what are the recommendations for macronutrients and micronutrients? So for our calories, so definition lang ng calories, energy in foods that provide your body with fuel. So to maintain your lean body mass, you may need to increase your calories. So yun yung theoretical case natin kanina na yung sa upbuilding diet, it needs na mag-increase ng calories. So to get enough calories, you should consume 30 to 35 kilocalories per kilogram of your body weight if you want to maintain your weight given na normal yung BMI mo. So if sedentary ka or normal yung physical activity mo, you can just use 30 kcal per kilogram. And if you have an active lifestyle, like you always work out, you do cardio exercises, or yung trabaho mo, it entails na very yung mataas na energy yung kailangan. So you can use 35 to 40 kcal per kilogram body weight when you compute for your calories. So for protein, these are good sources of protein. So extra lean pork or beef, skinless chicken breast, fish, and low-fat dairy products. So important yung protein kasi in people living with HIV, sometimes mataas yung muscle wasting nila, nagiging hectic sila. So it's really important na may adequate source tayo, especially good source of protein sa kanila. Next would be carbohydrates. So aside from rice, other good sources of carbohydrates would be legumes and whole grains. You can also use brown rice and quinoa. So if Not gluten sensitive naman, pwede namang mga whole wheat flour, oats, and barley. And kapag gluten sensitive, you should avoid yung mga whole wheat flour, oats, and barley and stick with just brown rice, quinoa, and potato. So it's really important na may good sources of fiber tayo sa mga carb sources natin since sabi ko nga kanina na it aids in our digestion as well. And of course, if you have other complications such as diabetes, so most of your carbohydrate sources should come from vegetables and like mga complex carbohydrates, and you should avoid yung mga simple sugars such as yung mga sweets natin like candies, cakes, cookies, or ice cream. Next would be fats. So fats, hindi siya masama, hindi siya kalaban natin when it comes sa dieting natin. So it is said na 30% of our daily calories should come from fat, and 10% of that 30%, 10% of our total calories should come from monounsaturated fatty acids, as mga avocado, fatty fish, canola oils, olive oils. Also, less than 10% should come from polyunsaturated fatty acids such as mga fish natin, walnuts, flaxseed, corn, etc. And less than 7%. So mas pababa should come from saturated fat. So ito na yung mga magagaling sa mga fatty meat natin, chicken na may skin, yung poultry with skin, butter, whole nut dairy foods, coconut, and palm oil. So basically, we should just limit yung ating mga saturated fatty acids since it's related sa ating mga cardiovascular diseases, such as mga heart diseases natin, hypertension, which could further complicate yung ating HIV status. Next, we'll proceed naman sa vitamins and minerals natin. So these are the common, some of our vitamins and minerals na we need to pay attention to, like vitamin A and beta-carotene, vitamin E, vitamin C, B vitamins. It's really important yung B vitamins natin since it helps in the absorption of our macronutrients like carbohydrates, protein, and fats, selenium, and zinc. So these are just some examples of food items that you can incorporate in the diet of our friends, people living with HIV. So here, when it comes to supplements, so it is said na it is difficult to get enough of all the nutrients you need from foods. So your healthcare provider may recommend a multivitamin or mineral tablet. So may toxicity din yung ating mga vitamins and minerals. So hindi siya parang di dapat natin siya inumin or i-take ng sobrang daming amount. So sabi nga, more is not always better. And when it comes to nutritional supplements like yung sa theoretical case natin kanina, when it comes to yung mga mass gainers, mga protein shakes, so hindi naman siya masama as long as wala kang underlying na mga diseases such as mga renal diseases na important i-consider yung mga creatinine natin and yung protein natin. Pero if kaya naman siyang idaan through diet, if nakakakain naman ng maayos yung patient or yung if kaya naman idaan through proper food intake, then better yon compared sa pag-take ng supplements. Like, it's just a supplement, pandagdag lang. Pero if kaya naman through diet, pwede na tayong sa diet na lang. So these are the common complications in HIV patients. So we'll discuss yung kung ano ba yung mga proper, yung mga common complications and how we'll address it through diet and nutrition. So one example of special problem would be nausea and vomiting. So a lot of people experience these. So they should try bland, low-fat foods such as plain pasta, canned fruit, or maybe mga crackers, mga skyflakes. And advisable din na smaller meals every 1 to 2 hours. So small frequent feeding para hindi nabibigla yung stomach nila or yung GI tract nila kapag nag-i-intake na sila ng pagkain. Next, they should avoid greasy or spicy foods since minsan yung amoy pa lang ng food or yung taste ng kapag mataas sa fat, minsan nagtitrigger na agad yun ng vomiting and nausea sa kanila. Pwede din sila mag-take ng mga tea like ginger tea. And if possible na ang kakainin nila ay mas malamig na pagkain compared sa mainit na pagkain para hindi sumasakit yung mga lalamunan nila. Then, rest between meals, wag agad hihiga or matutulog after kumain. And especially, you should ask your healthcare provider, such as your doctor, when it comes to nausea medications. Next is diarrhea. So drink more fluids than usual to replenish your fluids and electrolytes in your body. You should also limit milk and sugary or caffeinated drinks. Eat slowly and more frequently. Advisable pa din na small frequent feedings kapag nagda-diarrhea. And avoid greasy foods. One example of diet that could help when it comes to diarrhea would be the brat diet. So it contains banana, rice, apple, toast, or tea. So they can eat that when kapag nagda-diarrhea, mga foods as well. So instead of fresh produce, they should try well-cooked vegetables and canned ones. So para maiwasan natin yung mga food infections na could trigger diarrhea din. Next is yung lack of appetite. So exercise can help stimulate your appetite. So there are a lot of hormones that can help stimulate your appetite through exercise. People should not drink too much right before meals para mas madami silang makain na pagkain and hindi sila mawalan ng gana. If possible, mas maganda if kakain sila with family and friends, hindi sila kakain mag-isa para hindi naman nila ma-feel na mag-isa lang sila kumakain and ma-feel nila yung support na part pa din sila ng society. So making meals as attractive as possible. Also advisable pa din. So laging advisable na smaller frequent meals, small frequent feedings, to include a variety of textures, shapes, and colors. So wag naman natin gawing boring yung kinakain nila. So mas ma-enhance yung appetite nila kapag nakita nila na maganda yung itsura ng pagkain nila. So if hindi pa din gumagana yung mga recommendations na to, they should ask their doctor na about medications that could help stimulate their appetite. For this one, if too much weight loss, recommended na dito yung upbuilding diet which na-discuss na natin kanina. So they should include more protein, carbohydrates, and fats in your diet. So you can use full cream milk or you can use cream. You can add cheese since these food items are high in calories. So pwede natin i-incorporate yan sa mga kinakain natin. Eat dried fruits or nuts for snacks since yung mga fruits and nuts natin ay high in calories din. So if hindi pa din nadadaan through diet and nutrition, they should talk to their doctor about adding nutrition supplements na na-discuss natin kanina such as yung mga Boost and Sure nutrition supplements na like mga mass gainers, mga whey protein to increase yung calories nila, calorie intake nila. And since yung nausea and vomiting and yung lack of appetite can also cause too much weight loss. So for mouth and swallowing problems, so part dito yung mga oral candidiasis, yung mga other complications. So they should just eat soft foods. So soft diet yung advisable like yogurt or mashed potatoes. So avoid raw vegetables since raw vegetables, medyo malutong sila, crunchy and matigas, and it could make it, so mahirap siya lunukin, mahirap siya iswallow ng mga patients natin. So it's better to cook vegetables instead. So choose softer fruits such as bananas or pears. Stay away from acidic foods such as oranges, lemons, and tomatoes since this could trigger yung acid ng stomach natin na mag-reflux sa mouth natin and sa esophagus natin. And lastly, see their doctor to make sure they have no opportunistic infection or need more diagnostic testing. So lastly, we'll discuss yung mga diet tips for people living with HIV. So what are the recommendations, final recommendations that we can consider when it comes to diet and nutrition? So first, eat plenty of fruits and vegetables. So paulit-ulit na tayo. So since fruits and vegetables are high in antioxidants, which could help protect their immune system. So aim to 5 to 9 servings of produce each day. So it is advisable na kada meal is almost half ng plate would be comprised of fruits and vegetables. So dapat each meal meron tayong fruits and vegetable na kasama. Next, go for lean protein. So the body uses it to build muscle and a strong immune system since alam naman natin na people living with HIV has a lot, nagkakaroon sila ng extreme muscle wasting So naging hectic sila. So it's really important na may incorporate natin yung lean protein sa diet natin. So these are healthy options like lean beef, poultry, fish, eggs, beans, and nuts. So ayan. Next, choose whole grains. This is for the carbohydrates. So it is said na parang yung gas natin sa sasakyan natin. So yung carbohydrates yung nagbibigay ng energy sa atin. So that makes whole grain carbs like brown rice, whole wheat bread, good sources of carbohydrates for us. This one, limit your sugar and salt intake. So HIV raises your chances of getting heart diseases. So it is said na too much sugar and salt can harm you. So aim for less than 10% of your calories na foods and drinks with added sugar. And for the sodium naman is dapat less than 2,300 milligrams per day lang. So wag na tayo mag-add ng salt sa table natin kapag kumakain tayo to limit yung sugar and salt intake natin. Next, have healthy fats in moderation. So fats provides high sources of energy. So it contains 9 kcal per gram yung fat natin. So if you're not trying to gain weight, limit yung intake natin ng fats. So good sources of fats would be nuts, vegetable oils, and of course, avocado. So it is a fruit na very high in fat. So yung advice natin kanina, you should always see your health provider, your healthcare provider, if you have any problems related to diet or weight, such as yung mga loss of appetite, nausea, and mouth issues. And next, eat the right amount of calories. So we discussed this already a while ago. So we should also maintain our normal body weight, since being overweight or obese can also raise your chances of getting long-term diseases like heart diseases, diabetes, and some cancer. So it's really important na ma-maintain natin yung healthy weight natin. Next is drink plenty of fluids, at least 8 to 10 cups of water per day. So liquids help carry nutrients, and it helps flush out used medications from our body. And lastly, very important for in providing care for people living with HIV is follow food safety rules, because HIV lowers our body's immune system, our protective immune system against germs. So even a mild case of food poisoning can lead to a serious infection or illness. So we should always practice food safety when it comes to preparing food or meals for people living with HIV. So we should always wash our hands, avoid raw foods like such as eggs. So if as much as possible, we should cook all meat, seafood, and poultry until they're well done. Rinse all fresh fruits and vegetables with clean water. We should always check expiration dates of our food, yung mga canned goods natin. Reheat leftovers thoroughly before you eat them. And if you're traveling abroad, better na, and hindi ka sure kung okay yung, if potable yung water nila, so you should stick to bottled water and avoid ice and unpasteurized drinks. So it is said, so this is a quote from Hippocrates, so let food be thy medicine and medicine be thy food. So it's really important na pahalagahan natin yung diet and nutrition natin, and since may important role siya sa overall na wellness and healing natin kapag may mga medical conditions tayo.